We're going to begin in Kisumu, where the county government has launched a primary health care program that will see community health workers deployed to supplement other healthcare initiatives. Last week's launch is also meant to ensure the success of the universal healthcare program, which is in place in the county on a pilot basis. Laura Otieno is now in Kisumu. Do we have her? Laura, good morning. What can you tell us about this?
Well, good morning, Sam. And indeed, last week, the county government of Kisumu launched primary healthcare, which is a kind of holistic program that will see the success of UHC in this pilot county. Now, primary healthcare is arguably the backbone of universal healthcare because it involves the community actively. For Kisumu County in particular, there are 2,500 community health workers, where previously they used to be called community health volunteers, but the county government ratified a bill that will see each of the 2,500 community health workers earn a 2,500 shilling stipend. Now, this is the ratification of the bill was quite rocky because back in 2015, the previous county assembly that was in place rejected the bill because initially there was the proposal to pay the workers 5,000 shillings, but then that figure had been downscaled, and now the county government set aside for in the supplementary budget, they put about 45 million shillings to ensure the payment of the community health workers across the remaining part of the financial year. But then the thorny issue is primary health care, which is a pivotal point of universal health care, actively involves the community. Now, the bigger question is, are these people who are, they actually are taken into the program under a volunteer basis? Do they have enough training? Because according to World Health Organization, during the Ebola outbreak in West Africa, about 800 community health workers lost their lives because they are the first contact in case of an epidemic or an outbreak. Then they are the first people that get in touch with patients. And also the basis of universal health coverage is a sort of referral system. So from CHWs, then they should be moving to public health centers, and then they should move to level 2 and level 3 and level 4 according to the intensity of the particular illness. But then now the bigger question, Sam, is in as much as there is a stipend or an incentive to attract more people to be recruited as community health workers, is there really a framework for the training of these people? Because also for UHC to be achieved, it is a holistic kind of process. It's not just about having community health workers, but it should be looking at sanitation, it should be looking at nutrition, maternal health and things like that. But what we have seen Kisumu County doing so far is only looking at one aspect of primary health care, but then ignoring the rest of the aspects. And currently in the ongoing legislative summit here in Kisumu, one of the talking points was the role of counties in the attainment of the universal of the Big Four agenda. Now, all of the three out of the four agenda are actually devolved. So it's county governments are playing a very big role in ensuring the success of this. And so Kisumu County coming on board and implementing PHC is looks like a noble initiative, but then the bigger question is how sustainable is the program, considering the wake of misappropriation of funds according to the Auditor General's report, and then now moving forward because the county also seeks to increase its revenue base. Is it really sustainable for the county to be raising 45 million shillings annually extra only for the payment of the community health workers? So of course those are some of the questions that we should be interrogating here in Kisumu County, and this is a story that we will be following up on in order to assess the success of the primary healthcare program and overall the UHC, which is being rolled on a pilot basis here in Kisumu County. Sam.
All right, just before we let you go, Laura, when you talk about 45 million shillings that is required for that, do you have an indication of how many community health workers would be necessary for every person who is in that county that has a population of, is it nearly or more than 1 million?
Well, indeed, Sam, that is also another thorny issue because looking at 2,500 people and 45 million shillings allocated by the county, but then we are looking at a struggling health force as it is, because currently the professional health workers, if I can call them that, those are the nurses and the doctors, who are already complaining of gross understaffing. There have been cases of not enough equipment in hospitals as well. So that is also a critical question, Sam, because in as much as they are recruiting community health workers, this is a population of about 1.5 million shillings according to county projections, and we're talking about 800 nurses and 300 doctors only supervising all these people. And even though they are bringing in these seemingly huge number of community health workers, which is also something that should be looked into to really confirm if there are 2,500 CHWs working in the county, then they should also be interrogating how to strengthen the existing health system in the county to ensure the success of UHC.